Hey, I'm Dr. Venturini. Thanks for joining me today where we're going into the lumbar spine to learn a little bit about the disc. So the disc is what separates each of the vertebrae here. It allows our spine to, have good motion and also compression. The disc is made up of an annular fibrocartilaginous material that contains within it a nucleus pulposus, which is just a fluid-filled area. So that fluid is non-compressible, which allows us to stand upright without shrinking, 6 inches or whatever. It's also one of the most common tissues that becomes injured is the disc. You may have heard of a disc bulge or disc herniation or something like that. So there's different variances to it. You could have just a slight bulge. You could have just tearing of the actual fibers and no change in the nucleus pulposus. You just have outer layer tear or damage. You could get a full rupture or herniation where the fluid has actually leaked out of the disc, and now the disc no longer contains that fluid, but it's actually gone out. So there's different degrees of that. Let's take a quick look here at what it looks like. It might give you a better idea. So you can see there, the cartilaginous is the ring fiber here, and then inside is that fluid-filled nucleus pulposus. And what I'm going to show you is how this disc actually becomes injured, right? Most of the time it's when we're flexing forward, bending, right? And also if we start to add load, like we're lifting something off the ground or extra weight, that increases the load. And it's also more common too if you're twisting. So that combination of bending, twisting with the weight is really what's going to set off this disc irritation and possible bulge or herniation. There's also other ways, if it's a chronic repetitive type motion, you may not be doing a lot of lifting, but you're doing a lot of bending constantly, day in, day out. Eventually that tissue can fail in a similar fashion. It's just more chronic instead of acute. Now let's kind of take a look at this. Here's just a little balloon that is going to mimic our disc. Now instead of being air like this, it's fluid, but just imagine. So and this is going to be our vertebra above and below, so the disc between there. Now when we bend forward, what that effectively does is compresses the front side and actually makes the back side more pressure, right? So we're putting pressure, we're bending forward and it's putting more pressure to the back side, pushing that fluid towards the posterior side. And same thing, as we extend, it does the opposite. As we extend like this, you can see how it gets bigger on the front, so it's pushing that fluid towards the front. Now, one of the things that happens with the disc is it's thinner. There's not as much ring on the posterior lateral side, and that's where you most commonly get the bulge or the injury. So bending forward and twisting, rotating, that's how you get injured. So one thing we'll do on next video is show an exercise that if you're having some disc issues or you think you are, it's an exercise you can try to see if you get relief. So stay tuned for that.